Hi everyone. Myself, Dr. Manjunath, consultant interventional pulmonologist and sleep specialist at Manipal Hospital Whitefield. Today, I'll be talking about obstructive sleep apnea. Obstructive sleep apnea is a condition wherein a predisposed individual will have stoppage in his breathings when he goes into deep sleeps. Persons who are obese, persons who are elderly in age group, and persons with predisposition of anatomical factors and other risk factors are at high risk of developing obstructive sleep apnea. Any person who has excessive snoring at nights or observed obstructive events by the family members, or who has got excessive daytime sleepiness, or whoever is having excessive tiredness during activities in the daytimes, or whoever doesn't wake up fresh in the morning from sleep are to be evaluated for obstructive sleep apnea. Persons whoever are at risk are to be evaluated clinically by filling up different questionnaires which are present to assess the excessive daytime sleepiness and other risk factors. They also need to be evaluated clinically by the physician to assess the Mallampati score, which also tells about the risk factors for obstructive sleep apnea. Apart from this, there is overnight polysomnography available, which can be done at hospital or at home, and there are different levels of polysomnography, that is from level 1 to level 4, which are used to diagnose obstructive sleep apnea. Undiagnosed or untreated obstructive sleep apnea leads to decreased oxygen levels in the body at night, especially in the deep sleep stage, and decreased oxygen supply to brain. This causes multiple problems, like it increases the risk of obesity, further obesity, diabetes, hypertension and cardiovascular diseases, as well as untreated and undiagnosed obstructive sleep apnea leads to excessive daytime sleepiness, which hinders the routine activities of a person, as well as it also increases the risk of accidents while driving because of sleepiness. Any person diagnosed with obstructive sleep apnea is usually asked to reduce his weight if he is obese, or if there are any anatomical predisposing factors, those can be reduced by surgical interventions. And one more option is to treat with overnight positive airway pressure therapy, which is delivered through a machine known as CPAP or BiPAP through different interfaces like nasal pads, nasal mask or oronasal mask, which are supposed to be worn throughout the night whenever we go into sleep and throughout the life. So any person having any excessive tiredness during daytime, sleepiness during daytime, or who snores excessively during night is supposed to get evaluated by consulting their physician, especially a pulmonologist or a sleep specialist. Thank you.